Do you frequently feel like your heart aches sometimes? Or maybe you've noticed your voice getting hoarse for no clear reason even though you haven't been shouting. What if I told you these could be warning signs of something serious hiding in the center of your chest, not your heart, but a type of blood cancer called mediastinal large B-cell lymphoma, MLBCL. This disease starts in the lymph cells deep in the chest right behind your breastbone, in an area called the mediastinum. Imagine a bunch of immune cells, B cells, suddenly turning bad and multiplying nonstop, forming a big lump. It's rare, but mostly affects young women in their 20s and 30s. You might feel fine at first, but over time that lump starts pressing on your lungs, heart, or windpipe. It's like having a silent squatter in your chest, slowly taking over space. Scary, right? So what causes these B cells to go rogue? Great question. Scientists don't know the exact trigger, but they've found clues. Think of your cells like tiny factories with instruction manuals, your DNA. Sometimes a typo happens in the manual, a gene mutation, especially in genes like SOX11 or abnormalities in chromosome 9. It's like your phone auto-correcting meat to meat, small error, big chaos. Also, some people with weakened immune systems or certain viral infections, like Epstein-Barr virus, may be more at risk. Just like a weak security system makes a house easier to break into, a glitch in your immune system might let these bad cells sneak past defenses. But here's the thing, most patients are healthy young people. No smoking, no bad habits. So it's not your fault, it's just bad biological luck. How would you know if something is wrong? Let us play detective. Suppose you start coughing for weeks, not because of cold, but because a tumor is gently squeezing your windpipe, like someone gently stepping on a garden hose. Or maybe you get short of breath climbing stairs. Your lungs cannot expand fully. Some people see swelling in their face or arms. That is because the tumor blocks blood flow back to the heart. Picture a traffic jam in your veins. Others have chest pain, night sweats, waking up soaked, like after a workout, or unexplained weight loss, losing a few pounds without trying. One young woman shared online, "I thought I was just stressed, but my collarbones started sticking out weirdly." If your body is sending these red flags, it is time to speak up. How do doctors catch this sneaky disease? First, they'll ask you about your symptoms, kind of like a medical interview. Then comes testing. A chest X-ray might show a big shadow in the middle of your chest. That's the tumor. But to be sure, you'll likely get a CT or PET scan, which are like 3D movie maps showing where the bad cells are glowing hot with activity. Next step, biopsy. This sounds scary, but it's removing a tiny piece of the tumor through a small cut or a needle. They examine it under a microscope. The cancer cells look big and angry, like bullies in a school photo. Once confirmed, treatment usually involves strong chemotherapy, drugs that kill fast-growing cells. Think of it as a full-scale cleanup crew. Sometimes, radiation is added to target leftover cells. Many patients respond well, especially when caught early. It's like turning off a fire alarm before the house burns down. Can we stop this before it starts? Right now, there's no sure way to prevent MLBCL because we don't know the exact cause. It's not like avoiding smoking to prevent lung cancer. But being body aware helps. Ask yourself, have I ignored these symptoms too long? Just like you update your phone for better security, listen to your body updates. Regular checkups won't catch it early every time, but if you're feeling off, constant fatigue, strange swelling, don't brush it off as just stress. Especially if you're a young woman, this cancer can sneak up. Healthy living, good food, sleep, and managing stress keeps your immune system strong. It's like upgrading your body's antivirus software. Not foolproof, but better protection. The good news, science is fighting back. In recent years, researchers found that many MLBCL patients have a unique protein on their cancer cells, CD30. That's like finding a special flag on an enemy base. Now, new drugs like brentuximab vedotin target that flag directly smart missiles instead of old-school bombs. Clinical trials are testing these with chemo to boost cure rates. Also, immunotherapy, boosting your own immune cells to hunt cancer, is showing promise. One study reported patients with relapsed MLBCL getting back into remission using new CAR T-cell therapy. Your T-cells retrained like superhero soldiers. These advances mean fewer side effects and more hope. Just 5 years ago, some of this felt like sci-fi. Now, it's real and changing lives.